Hello, everyone. I'm Michael Dillon, and I am an expert by experience with choice support. Today, I will be interviewing Amanda Stride, Deputy Director for the Local Authority Assessment Program for CQC, the Health and Social Care Regulator in England. This is a new duty as directed by an Act of Parliament for England, the Health and Social Care Act 2008, as amended by the Health and Care Act 2022. Now, just a little about me before I move over to Amanda, which is what we're all here for. I have been an EXE now for some 7 years. I became involved due to a close friend who developed frontal lobe dementia when he was 52. I also have a muscle wasting condition called sporadic inclusion body myositis, which is requiring me to be in contact with my local authority and other institutions. We all know what an important part local authorities play in the provision and execution of care, and becoming more so. Today, Amanda will tell us a great deal more about this and what happens next. So, now Amanda, how are you today?
Thank you, Michael. I'm very well, and it's a pleasure to be talking to you today. As you've said, I'm Deputy Director for the Local Authority work, so that means that I'm leading the team who are delivering on the local authority assessments, involved in all aspects of it, including setup and carrying out the assessments. A little bit about me. My background is primarily regulation these days because I have worked for CQC and for predecessor organisations for over 23 years. And during that time, I have seen and participated in the performance assessment of councils when we last did it. And I think that ended quite some years ago. So I'm delighted to be back being able to do the assessments of local authorities again.
Great. Thanks for that introduction, Amanda. So here is my first question to you. My understanding is that unlike your provider regulation, local authorities will not be going through a registration process, and CQC does not have enforcement powers in relation to local authorities. CQC will be assessing how local authorities fulfil their duties under the Care Act. This knowledge enables you to start to understand the quality of care in a local area or system and provide the independent assurance to the public of the quality of the care in that area. Now, before you answer that, I'm sneaking a little extra in here. Can you tell us also a bit about the background to the work you are carrying out as part of the Local Authority Assessment Program?
Yes, so as you've said, this is a new duty for us, and also going alongside that, we have the duty to assess integrated care systems to look at how they are meeting the needs of their local population. So those two pieces of work alongside each other. So in terms of the background, we updated our strategy a little while ago, and that detailed our priorities. And what we've been doing is putting those priorities and strategy into practice. One of the core ambitions running through that strategy is assessing local systems, and the other one is tackling inequalities in health and care. So this work really helps us to be meeting those priorities. As part of all of that, we've been changing the way that we regulate, and you'll hear lots of talk around our single assessment framework, and that's something we're introducing to replace the way that we have been doing things under the key lines of inquiry that we've been using. And our framework will be used for providers, for local authorities and for systems. So it'll be one framework across all of them. And it focuses on what matters to people who use health and social care and their families. So it really helps us direct what we're doing and make sure that people are at the heart of everything that we're doing. So we have a lot going on in that space. And then what we've been doing with the local authority work is we've been working with a range of stakeholders on our approach. What will it look like? What will we be doing? And how does that fit in with all the work that runs alongside with the single assessment framework introduction? Last year, we got to the point where we had produced enough that we were able to start testing it out. So we did some test and learn assessments, some very small scale assessments, with two local authorities, with Hampshire and Manchester, and we used them to really help us with the learning that we needed to make sure that we could really produce a really good methodology for how we would do this. And the advantage of that as well is that Hampshire and Manchester have then been able to be really helpful in sharing that learning with the local authorities as well. So we've been able to work in partnership with them. So where we're at now is the powers came into effect on the 1st of April. So we've been building on that approach. We've gone out to local authorities and said, we now need to do some pilots so we can pilot the full process that we've devised and see how it actually works in practice. So we're going to be doing that over the summer. We've started now, and we have 5 local authorities identified, which are Suffolk, North Lincolnshire, Birmingham City, Nottingham City and Lincolnshire County Council. So a good spread of different local authorities. And what we really want to do is test out, how does that methodology work in practice? Have we got the right ways of doing things so that we can then finalise our methodology in preparation later this year for carrying out a full assessment of all 153 local authorities.
Thank you. Now I've got more questions. Can you also tell me what the aim of the work is and the 9 quality statements that underpin that work, which you and the teams will be doing? And for example, the background and where we are now with it.
Yes, of course. So you've already touched on one of the main purposes of the work, and that's around generating an understanding of the quality of care in a local area and being able to provide that independent assurance to the public. It allows the public to then see exactly what it is that their local authority is doing in terms of the adult social care space and what the service is providing and the quality of that. It also means that we'll be shining a light on adult social care a lot more and raising its profile. So there's a lot that we can do to really boost up the profile of adult social care in this space. In terms of our quality statement, so our quality statements are part of this framework, and we framed them in terms of we statements and I statements. So you have a quality statement that says what is intended to be achieved, and the we statement is what, say, a local authority needs to do, and an I statement, which was developed with Think Local Act Personal, it's their I statements that we're using, is what somebody who uses services should be expecting to see. So we've tried to make sure that our language is really approachable and clear for what people need. And so what we have is 9 quality statements for authorities, and we've grouped them into themes around the Care Act duties. So we've grouped them into themes, but the areas that we're looking at are around assessing needs, planning and delivery, and planning and reviewing of care, how a local authority supports people to prevent them needing a service or prevent them needing more services to be healthier lives, how they maintain well-being, providing information and advice, those kind of things you expect from a local authority, but also around how they are commissioning and shaping that market to make sure that when people need care services of any description, that there is a diverse and robust market, that people have choice in, and that they support that market to provide good quality care. How they are looking at keeping people safe, and that's in terms of their safeguarding, but also in terms of that transition from people in the continuity of care that people experience when people are transitioning between services or transitioning from children's services to adult services. And we will be looking also at the leadership and the governance and their learning and innovation. Part of that is really around wanting to pull out the innovative care that local authorities provide as well. So it covers a whole range of things within that Care Act function.
Wow, thank you, Amanda. I mean, that is extremely helpful and is something that I'm sure everyone will understand a bit better. Now to my next question. Can you tell me about what you have been working on so far? And I know you have touched on that, but what has and is coming out from this work?
So in terms of what we have so far and what's coming out, we're in the very early pilot stages. The bits that we're in at the moment are very much around setting up the pilot work with the local authorities that volunteered. And as we're going along, we start to refine the process of what we do. So we're looking at how do we do things? How do we make sure we get that range of views, that range of evidence, that we can corroborate that evidence, and it gives us enough to be able to make a judgment on that local authority.
Thank you, Amanda. This is certainly interesting. and I could almost say complex, but you seem to have it down pat. So that's very encouraging. Now, another question. Can you tell me a bit about how the people using the services and the experts by experience who have been and will continue to be involved in the local authority assessment process?
I can, because people are central to everything we do, and we really want to make sure that people's voice is heard in that. So we, as an organisation, for everything we do, we work in co-production, and we have definitely been doing that on the local authority assessment work as we've been setting things up and looking at our methodologies. So we have an expert advisory group, and that includes experts by experience on that group. And we've held a variety of events and webinars and for a range of stakeholders, including people using services, to gain their feedback and help us shape what we've been doing. And we also are doing things like, as we're designing our reporting format, that gets tested with people who use services as well to make sure that it is readable and it meets people's needs. We were delighted as well because as part of the test and learn, we recruited a small team to undertake those test and learn assessments. And we've recruited a slightly bigger team, but still a small team for the pilots. And so we've been inducting them, and we've had experts by experience be involved with that induction and to really give the insight from experts by experience into our teams that will be doing that. So everything we've done has been really important to involve people, and particularly experts. In the assessments, we're trialling some different approaches in terms of how we will be doing things because they are pilots, so we want to see what works. But what we'll be doing is it starts from what does the local authority know? And we expect the local authority to be working in co-production. We expect them to be hearing the voices of the people that are using their services, and they should be influential in helping the local authority shape what they do. So we'll be asking them about that, but then we'll also be testing that out. So we will be talking to groups such as unpaid carers, advocacy groups, voluntary organisations, as well as providers and local authority staff and everything. And we'll be talking to Health Watch, all to gather the feedback about what the local authority is like and how they're delivering on those Care Act functions. We're also going to be case tracking a small number of people who are using the local authority service. And with their permission, we will be talking to them as well about their experience. We'll be using experts by experience as part of our local authority assessment teams to help us do that. And as we kind of develop the methodology more, we'll be looking for more ways to make sure we're including people's voice and building on that, and building on things that we already have in place, like tell us about your care forms and things like that. So we want to make sure it's central, but we also want to make sure we properly evaluate our pilot assessments so that we can say, did that work? Was it enough? And people that have helped us with that will be involved with that evaluation.
Well, thank you, Amanda. I am sure all my colleagues will find that clarifying and very interesting. Now for the next question. And yes, I have a few more. I just want to ask why CQC's local authority assessment work will matter to people like me and others who use those services.
So I think we all agree that adult social care needs to have a lot more focus. We need to know what's happening in our local areas. We all either use our local authorities for social care, either now or at some point in our lives, or a loved one will be using them. So it really matters to everybody how that local authority is functioning and how they are delivering on their duties. So we'll be able to raise that profile, and we'll be able to shine a spotlight on that, and we'll be able to give people the information to know what their local authority is doing. And because we'll have public reports and ratings, it means that people can read that report, see what their local authority is doing, see how it compares to other local authorities. And we can highlight via our reports the current challenges and risks within that local authority area, and we can show the impact that that has on local people. But we can also showcase the best practice and the innovative ways local authorities provide care and support people. Our approach is very much focused on improvement and using what's already in the sector to keep driving improvement, to encourage local authorities to share that good practice, share that innovation, and drive improvement both regionally and nationally. We'll also be using our assessments to feed into the integrated care system assessments as well. So that starts to give an overall picture of health and care services across an integrated care area as well. So that focuses on the whole system in the area, with the focus as well on reducing inequalities. But we also know that regulation itself, because you start to ask questions, because you start to look at things, our local authorities are already looking at what they do. They're already looking at the kinds of things we might be asking and how they can answer that and what else they could be doing to improve. So before we've even started to go across a threshold and start to ask a local authority some things, they're already starting to put other things in place to say, we've started to self-assess, we could get better at this. We know CQC will be interested in co-production, for example. Have we got that right? Are we doing that well? So it starts to drive that improvement. And so in the long term, people who are using services should feel those changes through the services that they use and the knowledge they have about what that local authority is doing, as well as being able to hold them to account for the things that they may not be doing as well.
Thank you, Amanda. And now I promise you, this is the last question. As a person who has been accessing local services for a long-term condition, can you tell me what kind of changes I might see locally as a member of the public and how local authorities may change as a consequence of the local authority assurance program undertaken by the CQC?
But I think as an individual, there might be other things that you see in terms of you might be seeing that the local authority is reaching out to you more to say, actually, we'd like your views on things, or we'd like you to be involved with some co-production with us. You might find we're reaching out to you to ask you for your feedback on a local authority, and that you can help shape what the local authority is doing with that feedback, the things you want them to be doing more of that are really working, or the things that may not be working. So there's individual parts that you'll be playing in that. But I think also it does go back to that powerful tool we have of making information public. So each individual will be able to look at that local authority and pull out some of the points that are relevant to them. So if somebody is an unpaid carer, they'll be able to see, how is my local authority doing? It might be, for some people, they might be thinking, well, I didn't realise I was an unpaid carer. But now I can see, actually, I should be contacting my local authority and I can expect something. So it will help with that kind of process as well.
Thank you, Amanda. This has been extremely good to learn and certainly brings an understanding to what is a new and exciting program for the public in CQC. And I hope I haven't worn you out too much. But I now want to thank you very much for speaking to me today, and on behalf of those listening too. This has been a very interesting and illuminating question and answer session. This now ends our discussion on local authority assessment, and I wish you all the best and your team's work, and we will speak soon.
Thank you very much. It's been a pleasure. Thank you so much for having me.